Second opinion doctors. What's the worst initial opinion? Story 1. I had a somewhat similar problem some years back. When I was just about to turn 15, my dad had finally saved enough money for our insurance to have a regular doctor for us. So he looked around and decided on one of the best doctors in our region. The first time I met her, she looked to be a couple months pregnant, and we began a normal physical. Everything looked good. Then we get to the mental side of the test. Something to note is that I haven't been diagnosed with anything yet because every person we went to refused to diagnose me despite the very obvious signs of neurodiversity and other learning disabilities. The only one of which that was known but not confirmed was dyslexia. So on my medical records, it showed only 1 or 2 severe incidents and my check-ins as an infant. My doctor at the time looked at none of this and instead, upon finishing the question, told my dad that she's prescribing Prozac for my teenage depression. My dad looked concerned and softly mentioned how he didn't think that's a good idea at my age. My dad has also had depression, undiagnosed, and knew that everyone in my family didn't react well to Prozac around my age. All of this information on my medical records to watch for, along with cardiovascular problems from a family history perspective. My doctor didn't even give it a second thought and ignored our concerns. So I went on Prozac, and about 3 weeks later, not much has changed in any way. The doctor looks at this and calls it a success. What she didn't know was I was a ticking time bomb. After about a week after I saw her, that bomb went off as my dad was out of state. I had my 3rd attempt in my life to that point. Because my dad was out of state, no hospital was willing to take me since I had only just started and wasn't critical. So the school just sent me home and told my older brother to keep an eye on me. When we went in to see the doctor, we were told she was now on maternity leave, but that there was an opening with another doctor. My dad, being desperate, said yes. This was by far the best thing he could have done, as I still see this doctor. She sat me down and just talked with me. We started with the topic at hand, but it divulged into my life story. After I stopped dazing out when talking, she looked at me and said, "You're a very honest person. That's good. It means it'll be easier for people to help you when you need it. That being said, I read through some history and hearing what you told me, I'm diagnosing you with major depressive disorder, or GAD. I would like to start you on a med that can help you with your episodes and loss of reality. So why don't you do some research, I suggest, and then talk to me about why she suggested each one. I then did research and came back with my findings and agreed on one of the meds she suggested. Suddenly, I improved drastically. Today, we're both fighting for me to actually get the diagnosis so my future doctor can have an easier time working with me and understanding why I put my foot down. After my dad saw how that went, she became my family's primary doctor, and she's done an incredible job. What's even crazier is that about a year later, I had a similar incident, but not nearly as bad. Still frustrating that a lot of doctors think that a PhD makes them gods. Doctors and clients should work together more often on things like this. It's really interesting that the doctor that was more successful in figuring out what was wrong with the patient just sat and talked to the person, found out more about their home life and their life period and communicating with them, instead of just looking at charts and just prescribing some sort of substance sight unseen. It's something about communicating and connecting with your patients that really makes it worthwhile, really makes it effective. Story 2. I've got a scary one for you. I was born with a rare genetic syndrome. It took me a long time to even identify it, so I was a wild card for any doctor who met me. Still am. Ever since birth, I was almost constantly screaming and throwing my head back. I had a lot of skeletal abnormalities and a large head. Highly suspected I had neurological issues. But did they check my neck? Nope. Several times, multiple doctors would examine my neck because my mom was badgering them nonstop and come to the same presumptuous conclusion and never bother to order imaging. My pediatrician had the audacity to say for 9 months that it was just colic. When I finally had a head and neck MRI, it was like a scene straight out of a medical drama. The guy watching the scan calls the radiologist over in a panic. The radiologist calls the neurosurgeon immediately. The neurosurgeon, who was at another hospital that day, dropped his entire schedule to come see me. It was a spinal cord compression at C1. It was millimeters from my brainstem. I had had this since birth and had been at risk of my brainstem being crushed for who knows how much of that time. It's a miracle I can walk or even breathe unassisted right now. My case made the rounds at the children's hospital, and my pediatrician had his butt handed to him by the next pediatrician who took my case. The first one fired me. He was annoyed by my mom's constant nagging. This diagnosis wasn't obvious or anything from just those symptoms, but it was clear I needed imaging way sooner. I was lucky to have one of the best neurosurgeons in the country. He's known for his work on operating on inoperable brain tumors. I get to walk away with just mild muscle spasticity and other benign oddities for all that trouble because of his amazing work. Mild muscle spasticity. That's the word I was looking for. Mild muscle spasticity. And I kind of wish I would have been there to see the second doctor just really lay into the first doctor like that. I just wonder why they just didn't go with the imaging to check for some of these issues. Was her crying and her colickiness just looking like every other colicky child that was happening? I just don't know. I wish we could have seen what the difference was. And how can a doctor fire their client? I think it would be the other way around. At this point, it was the doctor that should have been fired from this. Story 3. Not a doctor, but it's happened to me a few times. First, my ADHD test when I was a kid. First doctor told my parents I probably had ADHD. My parents, being reasonable blue-collar parents who didn't know much about psychiatry, it was late 90s, early 2000s, got a second opinion to be sure. Second doctor said I had ODD. In all fairness, I probably also had that, but that was never the primary issue. They took me to a third to be sure, and they said I was just smart and bored. This was when I was 3. I turned 26 yesterday, and I only got diagnosed with ADHD a little over a year ago. Second time, it was my uterus. I had had hellacious periods since I started at 11. At 13, my family doctor referred us to an OB who, trigger warning, SA reference and garbage medical practices, proceeded to give me a pelvic without any warning and barely any lubrication. Then, when I was crying, said she didn't see anything that would cause that kind of pain. Looked to my mom and said, I think she's exaggerating her pain while ignoring a crying, clearly distressed 13-year-old. I'm a CSA survivor, so you can imagine what this did. I didn't go back to an OB-GYN for a proper exam till I was 19. Diagnosed with PCOS then diagnosed with likely endometriosis a year ago. Remember, I just turned 26 yesterday. Last wasn't necessarily a second opinion, but a second diagnosis from the same doctor. I got diagnosed with type 1 diabetes a week before I turned 15. Later that year, I started throwing up all the time. Waited 6 months for a pediatric GI. He came in, looked me over, and said I needed to lose weight. I've sat at a size 16 since I hit puberty. He sent me across the state for an endoscopy and found the very beginnings of ulcers. They gave me antibiotics and I was still getting sick. We go back. Same GI says he still thinks it's my weight, but he'd check my gallbladder, just in case. My gallbladder was functioning at 4%, and I got it removed on a Friday. The surgeon told me if I'd waited till Monday for the surgery, I would have ended up in the ER over the weekend for it rupturing. The whole story kind of sounds like she was just getting misdiagnosed all over the place. It's kind of hard to keep track which doctor she kept getting bounced to and what diagnosis was sending her to which other doctor. At least a critical one, I'm very glad that she got it taken care of before it ruptured. That would have been just awful. Story 4. 2 stories. 1. My mother saw a cardiologist who insisted she go for heart surgery yesterday, if not sooner. She agreed and was in the hospital the next morning. She was very surprised to wake up in the recovery room with no sign of any surgical procedure, and even more surprised when the surgeon came into the room and told her the cardiologist had made a mistake and she did not only not need surgery, she didn't even have the problem she'd been diagnosed with. 2. Sort of a reverse second opinion story. My mother was a public school teacher, and one day one of her students came in looking kind of sallow. The next couple of days, the same student came in looking more yellow each day, until the day he didn't show up, and the front office told her the student had been taken to the hospital to be treated for advanced jaundice. The next week, the student was back as if nothing happened and said they'd spend 2 days in the hospital undergoing multiple tests, some of which were very painful, with nothing giving an answer the medical staff could agree on. Then, a nurse gave him a sponge bath and his skin magically began to get pink again. Turns out, he'd been given a new set of pajamas. Yellow, of course, and had been wearing them to bed new out of the package without pre-wash. So the bright yellow dye in the pajamas had been rubbing off into the top surface of his skin. My mother is in her late 80s and still washes all new clothing before wearing it. Story 5. Not a doctor, but a patient. I was very much a hypochondriac when I was a kid, and I went to the school nurse a lot because I was terrified of having serious medical issues. One day in the 2nd grade, I had horrible stomach pain. I was rocking back and forth with my arms around my stomach and apparently making noises which I didn't even notice. My teacher ordered me to stop disrupting class, and when I didn't, she sent me to the nurse. The nurse said nothing was wrong with me. The teacher then sent me to the office for continuing to disrupt class, and I was suspended. A few days later, after suffering from not being able to bend at the waist or eat much and sleeping a ton, my mom finally realized it was serious and took me to the hospital. I was immediately admitted with a diagnosis of an incredibly swollen and ready-to-burst appendix that was infected. They rushed me into surgery ASAP, which took about a week since it was a very busy hospital. But I thankfully made it in time to not have my appendix rupture. The doctors told my mom that if I'd been even a day or 2 later to the hospital, I likely would have not survived. My mom was angry with the school for dismissing a very fatal thing, and the school was mortified over the whole ordeal. They made my entire 2nd grade class craft get well cards for me, and even bought flowers and a stuffed animal that they had delivered to my house. I've never trusted school nurses after that. Story 6. My second opinion came when I ended up in the ER with ketosis acidosis and slipping into a coma, thanks to a nurse that took one look at me and booked it to find a doc. He noticed I wasn't responding right and stopped me from going into a full coma. Never been so dehydrated in my life either. Felt like I was going to shrivel up like a dried prune. All because an urgent care doc decided my voice loss and extreme sore throat and other issues wasn't a big concern. I had onset bronchitis, which made my diabetes flip out pretty bad. I was still pretty new to it too, and didn't know what to look out for. The doc at the hospital was a witch too. Pretty sure she got fired after a bit, because she came in and was more worried about how I was going to pay. Then, how I was doing since coming in on death's door. She also had her fingers slammed in a drawer by another nurse when she was a real peen to my mom. After multiple trips and stays, she finally got diagnosed with diverticulitis. Bless that nurse, though. He took no trash from anyone when it came to the well-being of his patients.
Please like and subscribe if you've made it this far. I hope you'll enjoy the rest of the video and have a wonderful day.
Story 7. So, in the military, lots of the doctors are pretty lame. I had been to 2 appointments over 4 weeks about a sore throat that kept getting worse. I finally had enough and started doing research. I had massive swelling and my throat was coated in white patches. I went to the ER because the pain had been unbearable, and the doctor said it was probably strep, so they were going to give me some lozenges and send me on my way. She explained, "Well, penicillin is in short supply, so we're trying to save it for when it's absolutely necessary. And a course of oral antibiotics wouldn't even take effect until after it runs its course." Mind you, she hadn't even looked at my throat yet. I explained that it had been a long time and it was getting hard to breathe and begged her to give me something for it. She hits me with, "Fine, if it will make you feel better, I'll take a look at it." I open my mouth, and without a skip beat, she goes, "Oh, okay, well, we're going to get you some penicillin and some steroids to stop your throat from closing." "Yeah, thanks. How courteous of you." Story 8. I once accidentally diagnosed a coworker with a seizure disorder. We both worked at a fast casual restaurant, and she was known for being really clumsy, constantly tripping over her feet, dropping things, etc. We'd asked her about it before, and she told us she'd been to a few doctors who all said it was just her growing into her body. She was a teenager. That always seemed like kind of a weak explanation to me, especially since she said this had been happening her whole life. But I didn't say anything until one day we were cleaning together and I asked her again. This time she gave more detail and mentioned her vision would go white for a second and her body would just sort of stop during these episodes. I told her those were seizures. Don't even remember where I learned that. And she didn't believe me but promised to get it checked out at her next doctor's appointment. 2 weeks later, she came in and gave me a hug, told me I was right on the money, and her doctor said if it had gone untreated for much longer, she would have had permanent brain damage. Not to toot my own horn, but I'm still proud of that one. Story 9. The story about the stroke that was misdiagnosed as a sinus infection is exactly what happened to my first husband, right down to the 3 weeks in the hospital. He was 28. He not only spent 3 weeks in the hospital, but went 5 months with no ability to swallow and was fed entirely through a feeding tube for that time, and partially for another few months until he was able to take in enough food to have the tube removed. He and my 1-year-old son learned to walk at the same time. He was on disability for 5 years before he was able to return to work. I often wondered what would have happened if he had gotten timely treatment. What became really frustrating was that I continuously had to fight with the insurance companies. It changed a few times over the years, because an ambulance ride, MRI, or some other service wasn't covered for a sinus infection. The original diagnosis followed him, and it was hell trying to explain it was a misdiagnosis over and over again. Story 10. I had a dentist do a filling, and a week or 2 later, I got a dental cyst. I went back in with this weird lump on my gums, and they told me, "It's fine, it'll go away on its own." As an 18-year-old living alone for the first time, I trusted them because I had no idea you could get a second opinion. So I lived with this lump, and one day, it popped. And I called my dentist, and they told me to clean it and let it heal. So I did, and it kept popping over and over. Gross. And I kept cleaning it and calling, being told it's fine. Well, one day I started feeling the worst pain I'd ever felt in that tooth, and I went to another dentist because I was on the other side of the country, and they were really worried. Apparently, I could have lost part of my jaw because of following the advice of this other dentist. The whole tooth needed to be removed. The moral of the story is, if something feels off, don't bite your tongue about it. A doctor's, dentist, or other professional's pride is not worth your health. To them, it's a job, but for you, it can be life or death. Story 11. My original doctor would alternate his diagnosis of me between, "You're sleeping too much," and "You're not getting enough sleep." For about 3 years, my sleeping got progressively worse. One day, I got sick of my parents and family doctor ignoring me and set up a sleep diary, where I tracked my normal sleep schedule, without forcing myself to stay up 14 hours a day-ish. Then, I went to only getting 8 hours of sleep a day. I managed this for 2 days, would dunk my head in ice water, take freezing showers 5 times a day, would stand through all my classes. Then one day, I went to bed on a Saturday, woke up Monday evening. Didn't realize I missed school. Parents didn't even notice I was home. Went to school Tuesday and gave the school counselor my sleep diary and told her what happened. A therapist came to the school 2 weeks later, took me to the doctor's without my parents. My doctor tried telling him that I was just sleeping too much, citing my sleep diary, and he asked for a second opinion. After some time, another doctor immediately got me my first lab requisition. Turns out I had a severely underactive thyroid and most likely would have slipped into a coma within the year and been unable to recover. Story 12. A few years ago, my mom was suffering from cramps, back pain, and bleeding. All common signs of being on your period, except that by that point, she'd been through menopause and hadn't had her period for about 5 or 6 years before this. She goes to the doctor, which she hates doing. My mom is terrified of doctors. And the doctor tells her that she must have been mistaken about menopause and was just menstruating as normal. Second opinion time. She saw another doctor who ran tests and did a biopsy of her uterus. Turns out we'd caught the very beginning stages of uterine cancer, which can get very bad very quickly. The new doctor recommended a couple of treatments, one of which was a full hysterectomy, which is what my mom opted for. 3 years later, she's still cancer-free. She did say she wished she'd taken the test results to the first doctor and told him off, though. She never got around to doing that. Story 13. I'm not a doctor. This is a same-day second opinion. I was at home just doing my usual routine. I had severe head pain. Everything started going black. My chest felt like it was being torn apart, and I collapsed. I felt like I was expiring. Once I came back, I couldn't move or talk. Laid there until I had the strength to crawl to the back door. I was outside banging on the door. Partner at the time rushed me to urgent care not far from my place. The people wouldn't help me get out of the car. A man taking his daughter there picked me up and rushed me inside. I had blacked out by that point, but apparently I was puking, crying, and screaming in the lobby. The front desk workers just told me to shut up. Finally back, hours of waiting in the room, the doctor refused to give me an MRI, saying I was just there to get substances. Another doctor looked at my symptoms and immediately got me an MRI. Within 30 minutes, a chopper took me to a neurological hospital. I had a ruptured cerebral aneurysm and hemorrhagic stroke and was hospitalized for months. Some people are just awful. Story 14. When we brought my mom into the hospital, she was in extreme pain and white as a paper sheet. They first did a blood test, and when they got the results back, they started asking us how much alcohol she consumes. We were puzzled and told them that she occasionally drinks a glass of champagne at birthdays or other festivities. Nothing more. They didn't believe us because her liver was kaput, and we would only have a few more days with her. Every new doctor asked us how much she drinks, and would not believe she was no alcoholic. On her last day, the doctor told us they found out my mom has a liver embolism. After the funeral, I got curious and dug through Mom's medical records. I was shocked to find out that her last 20 years were excruciating pain because of the embolism. 4 different doctors, including our family doc, treated my mom like a lying alcoholic, and that drove my mom into depression. I instantly switched my family doc. Story 15. My mom went to a doctor who diagnosed her with hysteria, saying she was faking it for attention since she wasn't married. She went to 3 more doctors who all just said, "Look, your first doctor said you were faking it, so we can't help you." Finally, she went to a doctor who is now our primary doctor who listened to her and decided to schedule her with a cardiologist. The cardiologist gave her some tests, and when he came back, he said, "You are the next person we are operating on in this hospital." Turns out she was having massive heart failure and would probably have perished by the end of the month. Story 16. I had a friend who was diagnosed with eczema. Another friend who worked in the medical field but wasn't a doctor or nurse looked that up in a medical dictionary and said it basically just means red irritated skin with no exact cause. So apparently it's just kind of a catch-all for, I don't know what's causing it, but your skin is red and irritated. The two of them discussed it, and it turned out she had a lanolin allergy and was working at a sheepskin store, which is why it was only on her hands and feet. She bought sheepskin slippers from the store. She stopped wearing the slippers, started wearing gloves at work, and boom, no more eczema. A random friend caring enough to ask a few questions solved the problem a doctor failed to. So disappointing.
Please leave your story in the comments. I would love to make a video on them in the future. Also, don't forget to like and subscribe.